uh, we would like to make some couple of small statements. First is that Pacific Spaces Healthcare is a hospital. It's a hospital. However, WHO now defines health as a complete physical, mental, and social well-being. And we are trying our best to cover all aspects of health at PSH. However, the issues with social health is very broad and they are very big. And Ma'am Ms. Ali here through Fiji Womens Crisis Center has been helping so many women of Fiji for decades. And they are very well established. And we are exploring synergies now to how to work with the Fiji Womens Crisis Center and do our part in ensuring the women who are treated wrong, who are hurt, how we can help them out. So some of the collaboration and promises that we are making today is that if any woman is abused or beaten or is hurt and is with MEM's organization, they can always come to PSH, to our hospital, and we'll provide them all the treatment for free at no cost at all as part of our support. We also would like to promote, as I have also said during the opening of PSH, that a woman's right over her own reproductive health is her own right. And we will be working very closely with MEM and the organization and see how we can actually promote this as well, because the United Nations Sustainable Development Goals, 17 goals, one of the goals clearly states that a female has a full right and authority over her own health, over her own reproductive health. And it's very important for her, and it's actually her fundamental right to be able to access reproductive health services. So we are glad to have met MEM today and to work with her in forming collaborations and supporting Fiji Womens Crisis Center's activities. We'll also be meeting Fiji Women's Rights Movement soon, so we can also form collaborations with them and see how we can also work with them and assist them and help them as well. So thank you all for coming. Ma'am, I would like to offer you to our association a small token of our appreciation and our support. And this will keep continuing.
Thank you very much.
Thank you very much for the excellent work you are doing. Thank you very much.
Thank you.
Look, it's a both of you. Thanks. Thank you very much.
So thank you very much for this wish. And I know I met you some time back, and you came and shook my hand, and I did not know that this is coming, that we were going to end up with this kind of a collaboration. You had offered your help 2 years ago, and thank you very much. This is quite substantial, and it will go. And thank you very much. The Crisis Center always is in need of funds, though we have very good traditional donors in the New Zealand and Australian government, but we don't have funding for other things like this. We have had to get our own funds together to help out a lot of women who are going through surgeries and so on, abandoned women who have gone through domestic violence, and so this will come in very handy for them, and thank you for the offer. I'm looking forward to the MOU that we'll be signing, hopefully, after more discussions. And you know, you talk about reproductive health of women, their reproductive rights. We don't want to talk about it in this country a lot. We just talk about reproductive health, but not our rights to reproductive health. And so on. We have seen very young girls in this country who are getting pregnant, and they have had to go through the pregnancy because there is nothing else available for them, or by the time they know there is something available, it is too late, and so on. So we want to avoid things like that, and as you said, it is a woman's right. She makes the decision about herself, what happens to her body. She knows why she wants to do what she wants to do. So this will be, I hope that this collaboration with us and our sister organization, Fiji Womens Rights Movement, and other organizations that want to come in, will open up this conversation which we are very scared to have in this country. So, and it'll be good, especially backed by an organization like yours, And yeah, and thank you very much and congratulations.
Thank you very much. Thank you. Naka.
Thank you.